To help stop this spike, we needed to rapidly expand our vaccine rollout. Since then, I'm proud to say that we've kicked it into high gear. On Thursday, we took the bold step of opening eligibility to anyone age 30 and older. We were the first province in Canada to take this leap, and we did it because this meant vaccines would be getting into arms quicker. Our incoming vaccine supply, which earlier this year was delayed and unpredictable, has finally stabilized, and the results have been remarkable. On the first day that we expanded to the whole population on May the 6th, we set a new record with nearly 60,000 doses in one day alone, a record high. And since then, we have, in fact, on the next Friday, we did more than 53,000 jabs. Altogether last week, we delivered over 270,000 doses of the vaccine, and that is incredible. A while back, I said that Generation X, had stepped up to the plate and booked appointments as quick as they could. Well, there's no doubt that millennials and Generation Z have also risen to the challenge in the last week or so. Yesterday, we took our vaccine program even further, opening bookings up to every Albertan age 12 and older. In one day alone, we booked more than 190,000 appointments through AHS, and pharmacies combined. There are now over 328,000 people already signed up and booked to get their shot over the next week. That's almost 10% of the entire eligible population in 1 week alone. We're booking appointments as fast as the incoming supply of vaccines allows. And that is why, by tomorrow, we fully expect to administer our 2 millionth dose in Alberta. To put it in perspective, it took Alberta 119 days to reach our first 1 million doses administered. And if we stay on target for tomorrow, it will have taken only 29 days to reach the 2nd million. This is a big milestone for our province, and I want to thank every Albertan who's done their part. I know there were many who waited patiently online and who have called one pharmacy after another trying to find an open spot. Many people got up early and stayed up late to get in line on the AHS booking system. We appreciate everyone being eager and showing patience. It should be a source of hope and confidence that millions of Albertans have now felt the relief of knowing that they are developing protection against this lethal virus. And I'm sure that thousands of parents and guardians across the province felt a burden lifted from their shoulders as they booked their kids' appointments. I've seen many parents say how it was even more emotional to book those appointments for their kids than when they booked appointments for themselves. All of these moments give us a brief glimpse towards the exit and the end of this pandemic and a return to normal life. Alberta is the only province in Canada offering the vaccine to anyone 12 years of age and older right now. In fact, we are leaps and bounds ahead of other provinces in terms of the breadth of our rollout when it comes to rolling out the vaccine to the general population. In other provinces, you have to be older than 30 or in some cases 40 to get vaccinated. But we've kept it simple in Alberta, focusing at first on the elderly and others more likely to get sick from COVID, which is why we've been able now to open it up to the general population. Since day one of Alberta's vaccine rollout, we've held firm to a single guiding principle: to protect the vulnerable first. A total of 3.8 million Albertans are now eligible, and we will do whatever it takes to get doses into their arms. The results we have achieved through this approach are promising. By starting our vaccine program with our elderly who were most at risk, we've seen a dramatic decrease in the most severe COVID-19 outcomes. That is to say, the ratio of cases to hospitalizations and, most importantly, the loss of life. During Wave 2, those 65 and older made up more than 60% of hospitalizations. This has decreased about 36% of hospitalizations in April and May. And currently, only about 2 out of 10 Albertans hospitalized due to COVID-19 are over the age of 75, a drop of 50% from the wave we experienced in November, December. While these are big decreases, we only need to look to our long-term care and supportive living residents to signal how truly effective the vaccines are. During the second wave, about 1 in 4 hospitalizations were long-term care and designated supportive living residents. Now, in the third wave, only 2% are. And we've almost stamped out hospitalizations amongst this especially vulnerable group. It's remarkable to see the effect of the vaccines have on the group that this group in particular, seen as many have now received both doses. In fact, we're leading the country in double doses administered at about 8.3%. Tragically, during the second wave, we've had a daily average of 18 COVID-19 related deaths, but since the beginning of April, this has decreased to 3 daily deaths on average. This means our fatality rate has decreased from 2.7% during the second wave to below 1% now. While every single loss is felt throughout the province and grieved over by loved ones and family, it is encouraging that we have been able to offer protection to so many Albertans and to prevent even more severe outcomes because of vaccines. I hope that this information stresses just how important it is for Albertans to continue to make the choice to get vaccinated. As more of us make the choice to be vaccinated, this circle of protection from severe outcomes will continue to grow, capturing younger and younger age groups as well. Today, nearly 45% of Albertans 16 years of age and older are now protected with at least 1 dose of vaccine. This means that about 1 in 3 Albertans have made the choice to get their vaccine, helping us get closer to widespread immunity. While this is tremendous progress, we will not slow down. Based on our current supply, we expect to have 1/2 of the population vaccinated by the first week of June and 2/3 around the 3rd week of June. A total of 3.8 million Albertans, as I mentioned, are now eligible, and we'll do whatever we can to administer those. So in the coming days, we'll be ramping up our advertising campaign to help all Albertans understand that getting vaccinated will help us all get back to normal. Albertans will begin to see ads like this one pop up on billboards in their social media feeds over the next few days. The message is as simple as it is powerful. Your vaccine is your ticket back to normal life. Of course, the first dose is only half the battle. For all vaccines currently available in Alberta, it takes 2 doses for you to be fully protected. We're already working to make it even quicker and easier to roll out millions of second doses this summer. And as I said, we're at a head start compared to other provinces. Work is underway to develop a new one-stop centralized booking system that'll let you book appointments at AHS clinics, pharmacies, or participating physicians' offices. This will help not only roll out the COVID vaccine, but flu shots and other vaccines too. I'll have more information to share on this system when it launches next month. And we are also working with the Department of Education on potentially rolling out school clinics for vaccination for those 12 and older. Meanwhile, I'm asking everyone to book their dose as soon as possible. Take the first appointment you can get and to keep checking with pharmacies or AHS through their website or by calling 811, because more appointments will open up as the supply is confirmed, and we are looking to receive about 1 million doses over the next 3 weeks. If you manage to book an earlier or more convenient appointment, make sure to cancel the first one so someone else can use it. If this urgent sense of us needing to come together to protect not only ourselves, but others and the future of our province isn't truly Albertan, then I don't really know what is. So I know that it may be tempting to ease up on all measures, but I assure those who have had 1 dose of vaccines, all 1.6 million of you, to keep following the public health measures in place. While first doses provide a lot of protection, you don't get the full protective power of the vaccines until 2 weeks after your second dose. And even though you may have 1 dose, your loved ones, a cashier at the grocery store, or a person that you have some encounter with may not have had their first appointment yet. We all need you to hold on just a little while longer, to follow the current restrictions, to wear a mask, to help us protect everyone until they're vaccinated.